more on this, let's speak to Karin Kallander, who joins me now from Geneva. She's a senior research advisor at Malaria Consoritum, an international non-governmental organisation who deal in malaria. Now, Karin, thank you very much for joining us. Why have the number of cases of malaria decreased?
Well, to start with, malaria used to be almost a neglected tropical disease, which received very little investment and very little attention by the global community. But in the year 2000, things changed, and very much due to the creation of the Millennium Development Goals, which have quite a heavy focus on infectious diseases and child mortality. That led to a significant investment in interventions that can reduce both transmission and infection for malaria. And it's really quite simple innovations that have now been scaled up across the world. It's things such as insecticide-treated bed nets. There's inside residual spraying for mosquitoes, but also the scale-up of effective medications such as the artemisinin-based combination therapies, and making sure that those treatments get out there to the most rural and poor populations where the most burden of malaria exists.
Well, you talk about those existing treatments, things like insecticide-treated nets, but what else needs to be done? And also, what can be done to tackle dengue fever, which of course is transmitted also by mosquitoes?
Well, what else needs to be done? We shouldn't, while we should celebrate the success that we see in this report, there's still a lot of work that needs to be done. We still have hundreds of thousands of children across the world, primarily in sub-Saharan Africa, from this preventable disease. So what we need to do is continue to invest in this disease, to continue to invest in interventions and building the health systems that need to be dealing with this disease. We need to train health workers, and we really need to make sure that these treatments reach the most poor and vulnerable populations. We also need to make sure that countries who have reached elimination or are nearly there, especially in Southeast Asia, that we continue investing in the disease and make sure that there is no resurgence. And what we see in Asia is there's also a risk or a threat that resistant malaria is spreading quite rapidly. So there's a big challenge trying to address that through better surveillance and information systems in these countries.
Well, Karin, good news, but still more to be done. Thank you very much for joining us there from Geneva.